Hi everyone, Andrea here, owner and senior podiatrist at AC Podiatry. Gang, what I want to talk to you about today is actually knee pain. Now I know what a lot of you are thinking, hang on Andrea, why are you talking to us about knee pain? You're a podiatrist, don't you deal with ankles and feet? I know you do a lot of talking about Achilles. Look, the reality is there are some conditions in and around the knee that podiatrists are very, very good at helping with, okay? And the one I want to talk to you about specifically, because there's heaps of them, but the one I want to talk to you about today is called Patello Femoral Joint Pain, okay? It's a very common problem. We see it a lot in both young cohorts, so kids, but also athletic cohorts and population, and even in older people, because you can get actually osteoarthritis of the patellofemoral joint. And we can use podiatry to help relieve this particular problem. Now, the first question you're asking is, well, hang on, what's the patellofemoral joint? Well, the patellofemoral joint basically is the joint where the kneecap basically rests against your leg. So in behind the patella or the kneecap where it touches onto the thigh bone. Now, when you have patellofemoral joint pain, it's generally characterized by a kind of diffuse soreness around the front of the knee, okay? It can be aggravated by squatting, climbing stairs, sitting for a long period of time and then getting up, okay? So these are generally the things that we see in a younger cohort, but as I said, even in an older cohort. Now, a lot of people think, oh, well, it's just potentially a tracking issue, so the kneecap doesn't go up and down, it gets pulled to the side by different muscle imbalances, which is true, okay? But I just conference last week, one of Australia's gurus, a podiatrist by the name of Andrea from Tasmania, spoke about how if it's untreated, there's a very strong possibility, if it's untreated in younger life or younger stages of life, it can actually manifest in arthritic change later on in life. So it's one of those conditions where if you are suffering or experiencing some patellofemoral joint pain now, it's probably worth managing and handling so that later on in life, the risk of that developing into an osteoarthritis is significantly reduced. Now, one of the things that Narelle spoke about, and which we've seen anecdotally in practice, but it's always nice to have that evidence back you up, is that one of the main drivers for patellofemoral joint pain is the knee actually moving towards the middle of the body. So if you think about knock-knee type position, so if you have a knee that moves across underneath your body, a knock-knee type position, that actually predisposes you to patellofemoral joint pain. And in those people who have patellofemoral joint pain, if you actually change the alignment of the knee, so if you straighten the knee, you can actually significantly reduce the pain. And so you say, okay, that's all well and good, Andre, but how the hell do you come in here? How do you guys as podiatrists help this out? Well, look, this is one of those things where if you have a pronated or flattened foot, okay, and your foot collapses in, your knee will, as a result, fall across the middle of your body. So if you're suffering with patellar joint pain, if you get a pair of orthotics which shifts the foot out, it has the effect of straightening the knee. And by straightening the knee, we realign it, reducing the stress on the patellofemoral joint and actually reducing pain. And it can be instant. So we've seen it in clinic, I've seen it in clinic every day, where I will tape a foot, support the foot, get a person to repeat a squat, which was initially painful. Once they're taped and repeat the squat, the pain disappears. So it's literally night and day. You change the alignment and you can actually reduce the pain. Now, it's not a case of the orthotics are the be-all and fix-all, okay? Orthoses are and should be seen as a short to medium-term intervention to allow you to build strength, release or stretch muscles, and basically improve the whole situation from your hip through to your foot to provide for better knee function and reducing the pain. But in my experience, as far as a quick and immediate fix to patellofemoral joint pain, a good pair of orthotics in a suitable pair of shoes can be the difference between not getting out on the court or on the field on a Saturday or paying for it the next day and playing pain-free without any aggravation and moving forward and doing everything you want to do, okay? So again, it's not just the orthotics. You need to do a stretching and strengthening program. And we love working in conjunction with physiotherapists, sports physicians, exercise physiologists, chiropractors, whoever and whatever it is you're seeing to basically create the best situation for you to move forward, to get the help that you need and get back to living your life to full potential. All right. So guys, that's me talking about patello femoral joint pain. We're really good at it. We can help with it. Look, give us a buzz, 8255 5575, or click the book now button above. If you've got any questions, shoot it below. And like always, if you know anybody who's suffering with this problem, if you think somebody would benefit, like the post, share, tag that person in, okay? Get the word out there. We always know we want to help people live their life to their full potential. This is a great way of doing it. Let people know so we can get them cracking, okay? All right, gang, I'm going to keep moving. Take it easy. Have a great day. I'll talk to you soon. Bye.